following the election, we have a new Cabinet Secretary for Health and Care. So does Angela. Constance have plans to revive the idea. Well, we can ask her because she's here now. Good morning. Thank you for being with us.
Good morning, Gary.
A lot of time, millions of pounds expended on the issue, but ultimately support for a National Care Service fell away. Is it, from your perspective, still the proposed direction of travel?
Well, for me, in many ways, reform of health and social care is unfinished business. I was on the backbenches during the COVID pandemic. I was one of the voices who spoke very much in favour of a national care service. I'm a former social worker, started my social care life working in residential care with adults with learning difficulties. And I'm very much enjoying the challenge of being the new Cabinet Secretary for Health and Care. Well, it is a big challenge, but I'm raring to go because where I agree with Andy Burnham, and I will start on a point of consensus, is that social care is deeply personal. Many of us will require it in the future, and many of us or our families will have experienced social care. And it's about an investment in Scotland, it's about dignity, it's about fairness, it's about access, but it's also about the overall health of the nation, how we take that pressure away from acute services and relocate more into prevention.
The slight problem is that I've just been looking at your manifesto that you stood on earlier this year, and it's a bit vague in terms of what your plans might actually be. You talked about renewal of how the NHS and social care system works, putting people at the heart of their own care. I mean, those are interesting words, but what do they mean in practice? I mean, what does renewal mean? Does it mean going back to the idea of a national care service?
So, I mean, while it's important that we can't always revisit arguments of the past, you will see in our manifesto that there's a big focus on public sector reform as a whole. We have to stop looking at health and social care in isolation. So we have to take, a bigger and broader view of this. We need to be taking people with us. And in my early discussion with opposition spokespeople, for example, I think there's a shared reflection that the integration of health and social care is a journey that is far from complete. We are obviously working hard in advance of the programme for government, so I can assure you all ministers are very busy, even although it's summer recess. But in terms of...
Sorry, I'm not hearing exactly what it is you want to do here. You talk about reform of public services. So what would that actually mean in practice? How would the delivery of social care change under what you want to do?
So first and foremost, services need to be sustainable. We know demand is growing. And that in many ways demand is growing beyond workforce growth or indeed the growth in investment that there has been. So services need to be sustainable, and that does mean service reform, and we need to build a consensus around that.
Sorry, we have heard this word reform a lot, but what does it mean? What do you mean in this context?
So if I can put it in very practical terms, unwarranted variation across the country isn't acceptable. So there needs to be that equity of access, and that is something I hear.
So depending on which local authority you live in can determine what kind of service you get, whether you get a service at all, in fact.
Yeah, so we need to be addressing that as well as the challenges around demand.
So is that about central government funding those services?
So, well, central government already does fund services either via local authorities who have an investment of nearly £16 billion. There's obviously investment that this government has made to support the real living wage. We have pursued and will continue to pursue every avenue in terms of investment in social care.
So why is the service patchy then?
Because demand is growing, people are living longer. That is, a blessing. And, there are different needs, and this isn't just with regards to, older people and the changing demographic in terms of, for example, adults with learning disabilities, people with, say, Down syndrome. They are all living longer, and that is to be welcomed. And our expectations are rightly different as well. And I think the work that Derek Feely did will stand the test of time, in that it was about people first and foremost, and our systems and our services need to be working around people and not expecting.
But still delivered at a local level rather than at a national level. You're not going to revisit the National Care Service.
Well, I think this is early days. As I say, we can't.
Well, you say early days, but there needs to be a sense of urgency here, doesn't there?
Well,
I
there
was looking at some figures from the Fraser of Ireland Institute. They've got projections. They say that actually the figures are difficult because actually up until now the Scottish Government hasn't really done full projections on this. But the highest figure suggests the number of older people drawing on adult social care services could increase to around 230,000 by 2047. That's an increase of almost 40%.
Yeah. So the first tier of action will be to implement the legislation that was passed last year at the end of the last Parliament, in terms of Anne's Law, this notion that, friends and family are integral, they are just as, if not more, essential than the care team, in terms of the rights to visitation. We need to remember carers. We have a commitment to carers for unpaid carers for breaks, that right to breaks, expanded advocacy, and we need to improve the flow of information. I mean, people should not be having to retell their story or their testimony time and time again. And there is a real opportunity with the National Social Work Agency to have better visibility on unmet need. And
what do you say to those? I mean, at least 9,000 people in Scotland still waiting for either a social care assessment or a home care package. I mean, what is your message to them in terms of how quickly you can deliver?
So there's a big job of work for the Scottish Government and our partners in health and social care and local government. I'm not going to demur from that. But in terms of my very early engagement with the sector, there are two things that come up time and time again. And this is where the Scottish Government is quite within our rights to be challenging the new Prime Minister to recognise that some of the policies that the UK government have pursued in the last 2 years are having a profoundly negative impact. Now, that doesn't, I'm not demurring from my responsibilities, but the hike in employers' national insurance contributions has placed a financial burden. And then there's the scrapping of the health and care visas. A year ago, we knew that 26% of the social care workforce were New Scots. They were immigrant workers who play an invaluable contribution. And again, as an early step, as part of our 100 days commitment, we are going to reopen the displaced workers scheme, and that's our way of supporting employers to recruit migrant workers that are already in the country.
In terms of the way all of this is paid for, and do you agree with the principle? Is it right that people have to sell their homes in some cases to pay for care?
So, it's something that we will certainly wrestle with. Is
the principle correct?
So the principle should be, people should get the health and social care that they need at that point of delivery. I think we should be open to different models, but if you, I think we would have to be very careful about moving away from current practice because
it would be unaffordable if you didn't actually have people paying for it in this way.
You don't have a credible path to reform if it's unaffordable, I suppose, is the note of caution I'm trying to chime here.
In terms of Andy Burnham talking about tough choices, and some have read that as being tax rises, Should we all be paying more for our care in the future? Although obviously, taxpayers now would be paying for the elderly right this minute, but ultimately investing in our own care in the future.
Well, of course, we should recognise that social care is an investment. Some of the language tends to be the language that talks about, the burden on the state and
death taxes. And we'll go back to Theresa May.
And I think that's deeply regrettable. This is an investment in our country, an investment in ourselves and our families. But it does have to be affordable. And one of the things I'm determined to do is that I can see that there is significant investment in health and social care. And I want to be able to follow that money to ensure that it's reaching the front line and that it's having maximum impact for the people that we want to serve.
Andy Burnham's driving this forward in England. He wants to make progress quite quickly, he says. Politically, it's going to be difficult for your government if he gets there first, given where we've been with this in Scotland.
I'm not sure. I don't see it as a race. I don't see it in those two-dimensional terms. I think the important thing here is how we can build consensus in the Scottish Parliament, bearing in mind the difficulties that the previous National Care Service legislation encountered. Opposition parties were all very critical, but there wasn't much in way of alternatives to the then government's proposition. But we're at the start of...
So you look at what Andy Burnham's going to do, and if he comes up with some good ideas, could you adopt them?
Well, I hope that Andy Burnham takes the opportunity to be more ambitious than the previous plan that was introduced by the UK government, an earlier Labour government, in terms of 2010, because that was around affordability and funding. Whereas our ambition, irrespective of what people think about the detail, our ambition around our care service proposals were around accountability, were around accessibility, were around people's rights, were around governance. So it was a very ambitious proposition. And I think government and indeed, I believe, opposition parties, I think we've all had, an opportunity to reflect. We are at the start of a new parliament, and I hope we can all work together to build a consensus. I should also say that Scottish Government officials have been engaging with the Casey review, that is not something new.
This is Louise Casey, who's leading the review in England.
There are always interesting points of comparison or indeed difference that is important to reflect upon. But it is... where we'll be watching very closely is that if the UK government take UK-wide measures around tax and pensions and immigration to help pay or alternatively support social care in England, well, we want to ensure that doesn't have an impact in Scotland.
Well, look, thank you very much indeed for giving us your time this morning. That's the Health Secretary, Angela Constance.